we're jumping into part 2 of obesity, where we talk about the complications of obesity and the struggle of people that are living with obesity. Dr. Babalola is going to share with us some new information she's seeing in the medical world for younger adults and younger children. So let's dive right in.
Yes, absolutely. Being a family physician, I'm trained to see all ages. I say from cradle to cane. And in my last few years' experience of being a family physician, we're finding now that our beautiful children are being stricken by not just overweight, but obesity. And when we define obesity, earlier on we gave this long title. This is based on the BMI, which is the Basal Metabolic Index. And what we're finding is that because of the correlation between obesity and chronic lifestyle-related diseases, as early as 9 years old is having type 2 diabetes. Because they're playing video games, they're eating ultra processed foods. So ultra processed foods just means foods that have been altered multiple times in the lab, whether you strip out all the nutrients and then you add chemicals, artificial colorings.
Like
yes, all those things that our kids are eating has increased their risk for diabetes, hypertension. We even have arthritis, which is inflammation. A lot of our pediatricians, and my youngest patient that I diagnosed with type 2 diabetes was 9 years old. And our pediatricians are saying, so pediatric age range is between that 18 and 21. The new pediatricians now are seeing diseases in this age range. The older pediatrician would finish their whole career and not even diagnose kids with these diseases. So that's the scary part. We're having, just based on the statistics, they're estimating that by 2030, if we don't make any changes, almost 50% of our kids, will have obesity. And let's not even begin to talk about adults. So that's why we have to wake up. I'm glad that you're doing this to shout the awareness, but we need to, as a family unit, come together and find healthier ways to live, because if we don't do that, not only are we affecting our cognitive function, we're leading to all these disabilities, right? The quality of life is affected. And these chronic diseases that I mentioned, diabetes, hypertension, heart disease, which we know heart disease is the number one killer, right? In adults, we don't want that to start affecting our kids, right? Cholesterol is even high. And I'm speaking from experience. Even my kids, as young as they were, I kept telling the pediatrician, my son is gaining so much weight. It was like, oh, his baby weight, he'll be fine. I was like, no, this is increasing. And even though, yes, school, we couldn't control what he was eating, at home, we tried to limit all the unhealthy things, but he was still gaining weight. And I insisted, please check his cholesterol. We have a family history. They said no. And not till when I told the pediatrician, I said, I can just draw the labs in my own practice for my child. Then she agreed. His cholesterol was high.
Wow.
Pre-diabetes. I started crying that day and I had to call my husband. I said, we really need to do a better job. We started learning to read labels together. Just because you see something saying it's healthy, we have to do our due diligence and read the label and see, is this ultra processed? Is it as close to the earth as possible? So it's a family affair, because we don't want to have our children growing up with these diseases. And unfortunately, the pharmaceutical company are not going to help, because that increases the lifespan of being on medication if the kids are sick at an earlier age, right? It's upon us as parents, as individuals of the community, to just have an understanding of what we need to do to have healthy homes and in healthy community.
Thank you for sharing that. In my household too, we've had a struggle. Don't give up. If you're one of those families, over years, what I've seen is if you continue to push the healthy, eventually they'll get it.
You're right.
You might be singing to the choir, but they're going to realize it when their health starts getting affected.
Yes.
They can't sleep very well, or they're having issues with joint issues. Like you said, if you have a lot of weight on, it's harder to move around, and it causes all other kinds of issues. So if you don't want that for yourself and you don't want to be on medication, which I'm not saying medication is bad, but who wants to be on the medication for their whole life and continuously? Who's getting your money? You want the doctor to get your money, or you want to own it and take your life back? I really want to do more than just so that when you take this information that you were sharing today, go back and ask yourself and say, what can I do today to make that change? Even though you're starting from a small step, just keep at it. eventually it's going to pay off.
Absolutely.
Why is hard for some people to seek help? We know that at school for kids, they get made fun of because they're overweight. They compare themselves to other kids. They don't know those kids' genetics.
Yes.
Even at work, people are made fun of because of their weight. And also, social media is not a great place. And where do our young kids and us adults spend most of our time? We spend our time on screen, on scrolling, and all those kind of things. And the images we see are not real. They've been filtered, and then society's promoting this skinny image, which is not real, and which is causing a lot of people to have emotional issues, self-esteem issues growing up. Even me till today, I didn't realize I was doing it until my children tell me, "Mom, you're always going on about weight. You're making me think about weight."
Oh,
I come from genetics of bigger bones. I'm not based on a skinny frame. I've learned to embody and appreciate who I am for myself, not what social media or magazines are telling me. I'm comfortable with being a full-bodied woman, and I'm still slim, and I still feel great, and I'm doing the right things, making the right choices. I'm not going to look at some magazine to tell me who I am.
yes, absolutely. Well said. I think that's so important that we understand that when we're talking about obesity, we're talking about the complications of obesity, right? So what is it doing? Psychosocial. It does play that role. There's something about your confidence. If you don't feel comfortable in your clothes, it's too tight. So there's that aspect of it. And I know I struggled with that. And we're big bones. And I used to idolize the number on the scale. My daughter heard me say that. And now I've love-hate relationship. I've dismissed that because it's beyond the scale. It's understanding what is the body composition. And that's where I emphasize to my kids and to my patients, focus on your health, right? Not in terms of your size, because we're all created differently, right? We're wonderfully and fearfully made. I say that all the time. Some people could be skinny, but is that skinny person healthy, right?
Yes.
That's the important thing. Now, if you're on the bigger side, but do you have less percentage body fat? Do you have more skeletal muscle? Because for me, in my family, we have more skeletal muscle, bone. So as long as we have decreased percentage body fat, the weight is not really going to tell you that. So I think the important message here is to focus on the metabolic health, how you feel. But I know there's kids and even some adults, it takes time to get to that place. I want the focus to be on overall how you feel, how your body is adapting to your frame. So that's usually the message. But again, it's one of those things, it takes time to get there. We have to reassure our kids as they see us model that we accept ourselves the way we are, as long as we're eating healthy and we're moving, right? That's what matters.
Great. And then the last thing on this is to have those issues and you're trying to get help. Not everybody can afford to go see a doctor or they have insurance. That's part of one of the reasons why I started this channel, to create a space how in the legal world they have a pro bono. I wanted to do something similar in the medical world. Healthcare professional can volunteer. You give so much back to your community. I see it all over your media, how much you give back, which is, I would say not every doctor is like that. And I'm just amazed about how you've done integrated medicine with your practice. I would like to see more healthcare professionals give their time, even if you can't do it for free. I've used mental health at a discount if it's telehealth, for instance. Let's say I can't go see a therapist for $130, even though my insurance won't cover that part. And we know obesity also is not just physical, medical medication, or it's also mental, right? We talked about how it affects people's mental health. So how do you get help? There is help out there, which is telehealth, which is a fraction of what it would cost if you were to see somebody. But there's stuff out there, so don't feel like you have to isolate yourself and be alone going through this.
No man is an island, right? Even more so when you're struggling with obesity. I know my son was bullied on the bus just as early as 6th grade when he started gaining weight, bullied, and then that will break any mom's heart, right? And I just had to reaffirm him, we love you. It's not, the amount of love we have for you has nothing to do with your weight, right? It's a struggle. Everybody is created different, but together we are going to do our best to eat healthier, to move more, right? And so he got to that point where he himself realized that he needed help, right? But if you isolate yourself, and I've heard all sorts of stories where people isolate, even adults, and they just eat and eat and eat, because the unfortunate thing is that we soothe with food. I know I've been there, an emotional eater, when about 16 years ago, had chronic blood pressure issues because I was overly stressed, an emotional eater, wanted to eat more sweets, and I had to soothe with other things other than food because that just made me gain more weight. I was thankful that I was able to lose all that weight as well as get off the medicine. And so I share my story with my kids, and so they understand that there's hope, right? And just because you're seeking help does not mean you're a failure. And that's another thing that I hear all the time. Oh, that means I can't do it. And my son has said this before. I've told him, listen, we're going to eat right, we're going to exercise, but if we're not making the progress as we would want, because medically, the truth is lifestyle can get you so far. Sometimes you might need additional help, and that's where the medications can come in. When you're ready, let's talk about this. They are FDA approved medications, but some people feel like if they use medications, that means they've absolutely failed. But that's not correct, because sometimes you might be that person. It's not a one size fit all. You might be that person that needs that additional help to quiet the food noise, because some people do naturally have that food noise that needs to be, and willpower by itself will not get you there. So I emphasize skill power. So first thing with skill power is that if you're already a sweet tooth, try and avoid putting it in the house. Out of sight is out of mind. Everybody, after we do it in my home, after we have dinner, we all get up and we do squats. We move around. It's a family affair. So we do that. We hold ourselves accountable to go to bed early. So there are things that skill power will do, but if you need that additional help, as an obesity medicine doctor, I know that medications do play a role. The medications work best if lifestyle medicine is the foundation, right? So you still have to eat right, you have to exercise, you have to sleep, because if you don't do all of that and you're just taking medication, you're just going to gain the whole weight back once you get off the medicine. The important message takeaway here is please do not figure this out on your own. You're not a failure if you need help, because it's a complex situation and everybody needs specific treatment tailored to the etiology, to the obesity crisis.
And this is valuable information. I've heard people say, why can't you just lose weight naturally? Why are you taking this medication? They look down on people saying that, oh, why are you forcing this? Why can't you have willpower to stop eating? So it's a lot more than like you say. And it's not only just because they want to stop, they just can't. They need that extra motivation and help to get past that way. Who will want that help if it's available? Just making sure that you doing it the right way, you're going to a medical professional to get the right medication, because we don't
so many
know how
out
it
there.
works.
Exactly.
I've heard the names of Wegovy, Ozempic, and available, but we don't know what works for who. So it's best to seek medical advice when you're
absolutely.
doing that.
And I like that you mentioned you have to be very careful if you go to a doctor that they're prescribing and they're giving very clear about the side effects, how long they're going to be on it, what to expect. Don't just go, because even I've seen it on the roadside where they have a stamp, oh, get your injections here. Yes, you have to be very careful. So you want to make sure that it's tailored towards you and you want to have clear instructions. The important thing is that you really need your lifestyle behaviors. That behavioral intervention needs to accompany if you're going to use medications. But again, it's not a one size fit all for everyone. And we don't want the blame or the shame because, again, it is a complex thing in terms of obesity.
I know that these medications came out, I don't know how long they've been around, but someone that's been on it, or is there something they need to think about as far as long-term? What's some research being done on this medication?
Yes.
Is there anything negative that we need to think about, or how long
should patients be on it? Well, I'm glad that you asked that question. And so the good news is that with these GLPs, GLP just means a protein. There's a long name for it, but not to burden you with a long name. We naturally make that protein. Our bodies naturally make it. Whenever we eat, it's released from our intestines to notify us that you've eaten enough, stop eating. But the one that we make, because of the way we've eaten over the years, we've just turned off the sound. You're not listening to it. It's like if your phone is ringing and you're not hearing it. So we naturally produce it. And so the pharmaceutical company did this long years of research on this medication, and then they made a synthetic one that is longer, it lasts longer. So that's why the injection is once a week. So it's longer reached. It keeps the food noise, because some people, they really do have food noise. They want to stop eating, but they're constantly thinking about food. So this medication actually has been tested and tried, and they found that it will keep that food noise because it works on the brain, it works on the intestine and several other sites. Now, in terms of side effects, what they found out was that there are two set of people that can take the medication because of risk of thyroid cancer. So if there was a family history of thyroid cancer, you disqualify. You can't have it because we don't want to give you something. The benefit of taking it should not outweigh the risk.
Absolutely.
Right?
Yeah.
So that's one. And then people that have pancreatitis, that means inflammation of the pancreas because it does work in those areas as well. So in terms of, those are the two contraindications. But in terms of long-term risk, there are precautions that patients that are taking the medications need to be aware of. It's what you call gastric paresis. And that just means because your food is going to digest very slowly, you have to be very careful. So acid reflux can be one of those long-term, but there are ways around. That's why you need to work with a qualified physician. I have patients that are prescribed the medications and they know how to use it appropriately in conjunction with lifestyle habits. It works phenomenally. We know people that shouldn't be on it, people that have an indication to be on it. We just monitor them closely.
That's good to know for me because I'm seriously considering that medication.
Some people need that extra pull. The way I describe it, if you're pulling down a pulley, right, and it's coming down, but after a while, your body is used to a set point of weight. What is it going to do? It's going to try and pull you back up. So lifestyle is helping you, but then some people need that additional medicine to keep going down and not to be pulled back up to gain that weight. Because when we eat less and we move more, your body is going to feel it and it's going to feel like you're going into a famine. And so it's going to slow down your metabolism and then it's naturally going to make you want to eat more and feel hungry. And so that's where sometimes that additional support is there. But the key thing is you want to work with a healthcare provider that would be able to make that call and see what else can they do to support that weight loss journey.
This is great advice. I thought I knew quite a bit after doing research, but I found out so many new things and I'm happy that this medication is not some that's going to harm you. So that's wonderful in the long term. This concludes our talk on obesity. And I want to summarize the takeaways. You can beat this, but it's going to take a lifestyle change. And you got to watch what you eat, which is nutrition. And if you need help with nutrition, I'll list several places where you can go for help. And you can also work with a nutritionist if you have a difficulty. One of the things I've heard about people when it comes to nutrition is there's nothing for my ethnic background. There's no, I see this menus like tuna, peanut butter. Where's my jollof rice? Where's my ethnic food in all of this? You can do it with ethnic food. And one of the things I actually researched, somebody challenged me and said, do a menu. So I did a menu because I do like Nigerian food. And instead of starches, I use cauliflower and I blend it and I put some psyllium husk in it. And that kind of gives me the texture of starch and I can eat it with my vegetables. And I win because I'm eating a vegetable with a vegetable, but it looks like a starch. So those kind of things. We need more nutritionists developing those kind of ethnic types of menu plans. And again, it's not a diet. Don't think about it as a
it's a lifestyle. Absolutely.
I'm with you. I'm going through it myself and my family. I hope this is meaningful for you. If you have any comments or anything you would like to hear more about, feel free to share it in the comments. All right. I want to talk about my YouTube channel a little bit more and also have an Instagram account. I'm looking for healthcare professionals who are interested in helping their community and in the areas of health and wellness. Helping people with dealing with issues concerning their health is always a plus. My channel, if you want to follow me, is at Prosper by Faith Beyond Vision, and my Instagram at abby.o_faith coach. I'll be sharing motivational stuff. And also Dr. Babalola has a couple of social media accounts that you guys can follow. Please share.
Yes, absolutely. Thanks for the opportunity. I would love to connect with you. Just like Abby, I really want to empower my community to make healthier choices. I went to school to get additional training so that I can not just help myself, but serve my community. So Living at Your Finest Wellness is where you can find me on all social media handles. I do have a YouTube channel as well. I talk about health-related topics, and I do have a podcast as well called Living at Your Finest. I have guest speakers come on as well. I do have some solo where we just talk about whole person care. I'm really big on spirit, soul, and body. I do have a practice in the Marietta area if you're looking for a physician that will prioritize your care and make sure that it's patient-centered. Give us a call.